20-month-old boy who loves to play and explore his surroundings. Ben has just started attending Rainbow Nursery, where his practitioner Ella noticed that he wasn't developing as quickly as his peers. Ben had limited speech and seemed that he had trouble understanding what was said to him. He also struggled with fine motor skills such as holding his sippy cup or manipulating toys, and wasn't yet walking. Ella was concerned about Ben's development and decided to observe him more closely during playtime. She noticed that Ben had trouble making eye contact and seemed to have difficulty paying attention. He also appeared to have trouble forming attachments with other children and became easily overwhelmed in social situations. What are your thoughts on this case study? What are your first thoughts?
Well, I think the first red flag, obviously, we discussed is the walking, him not being able to walk, which may present as an issue in the classroom with children who are all at that stage walking.
Yes.
That could be a bit difficult for the child. Although practitioners should be there to support the child and to help them through these difficulties.
So you're talking about what we can do
Exactly.
while he's in the nursery, and how we can support him inside the nursery with these difficulties.
Simple things like him not being able to hold his sippy cup, just constantly reinforcing and showing him. It would need a practitioner to be more one-on-one with him at certain times of the day where more support is needed, and just being available to give him that support and to teach him and to constantly show, because I think through repetition and showing him constantly, he will be able to get to a point where he is able to hold the sippy cup, especially if he is receiving therapies to help strengthen his fine motor development and everything else that's needed. His language is a cause for concern, although at that age there are many children at 20 months who are not able to articulate their words. So at this point, I don't think he would necessarily feel very frustrated in the classroom setting, because there are other kids who are at the same stage as that.
Yeah.
And interactions with other children, I think just giving him space for smaller interactions. So when there are 15 children at an art activity table, you're not going to allow him to engage and interact in that activity. Rather, take him out into the garden where there are 5 children, where he can feel more safe and secure, and explore surroundings where he's less overwhelmed.
Yeah, and just also remembering that he is settling.
Exactly.
So children who are settling new in the environment
go through these emotions regardless.
It could take them more time to interact with other children anyway.
Exactly.
So we just want to bear that in mind. Giving eye contact, that is a red flag.
Yes.
We would expect eye contact from a baby, from
Exactly.
newborns. So that is something that I find concerning. But there are things that you can use, to help him with the eye contact. I remember someone telling me to use the phrase, "I really love your eyes. You've got such beautiful eyes," and that can that could help with some eye contact.
Exactly. I think just him maybe also finding 1 or 2 practitioners who he feels really comfortable and constantly engaging and speaking to him all the time may also definitely help that aspect.
Yeah, I don't think it says in the case study about which language he uses. So
exactly, he may not understand English.
the first indicator that I would say is a huge red flag in that in the case study is the walking.
He's not able to walk.
Yeah, and that actually would probably be picked up before he even came to the GAN, to the nursery, and to because we do home visits for all new children. We visit them at their home, so walking would be picked up during the home visit.
Right. Interactions with children, obviously, they wouldn't necessarily know, especially if he's never been to GAN before. So that would be your first indicator.
Yeah.
At 20 months, they should be walking.
Yeah, we would expect children to start walking around the year mark up to 18 months. So past 18 months would be a cause for concern. So what's the first thing that we would do when the child, in this case study, the child's already started settling? The first thing that we would do is observe. We would observe the child. We would make written observations. What other observations would we do for?
We have our observations where you track the child for a period of time. It's about 10 minutes. And you follow the child around and move around with them and log in everything that they're doing at that particular time, whether it be outdoors or indoors during activity. You would track how they're interacting, how they're manipulating with different toys, materials, and then also throughout the day or throughout the week. You could take little post-it notes, and just as you're doing, whether it's an activity, how he's manipulating or holding the materials, or if he's sitting at snack, is he able to hold his sippy cup? Is he able to take it himself and drink it independently? If he's sitting at lunchtime, is he able to take the spoon and put it towards his mouth? So all these observations will eventually lead you to see exactly what are the issues and where he's delayed in his development.
And would help you also to track his development using the summative assessment form.
Exactly.
That we have.
Would give us clear knowledge, so when we do approach the parents, we've got clear knowledge and clarity of where the child is holding and exactly what we think will need to be done.
We would want to get that done pretty quickly in terms of the observations. He's just started with us, and we, with all of these observations, we would need to deal with it quite quickly.
Yeah. The earlier the intervention, the better for the child.
Yeah. So we would call for an immediate meeting with the parents and discuss with the parents our concerns. The first thing is obviously to tell the parents about what we've observed and to ask them
if they've also noticed anything that they're concerned about, because I'm sure their friends or family will notice that a child not walking at 20 months is a sign of concern.
Sometimes if that's happened in the past, they're already on something. They've spoken to their family doctor, to the pediatrician, and they're already kind of on some kind of observation process with outside agencies. So we would talk about that. So after you filled in the form, that will lead you into the Child Development Centre, who will then have you come for an appointment there. or for the parents to come for an appointment at the Child Development Centre to be...
Which includes your physio, your occupational therapy and your speech therapy.
Yeah, and probably a child psychologist as well would do an assessment. This is the route to go if you're going through your healthcare provider. Many parents, because that takes a long time, many parents do go in the private route, where they would where they would see someone privately.
Right, and then things get done a lot quicker that way.
Yeah, absolutely. And so we have a team that we would recommend. They run a child development centre, a private child development centre, which consists of therapists and psychologists.
And I'm sure during this time also the psychologists are able to provide support to the parents, because it can be quite traumatic for a parent to be going down this journey.
Yeah, definitely.
With their child.
Okay. Thank you very much.